Hi, Emily.
Hey, Megan.
Okay, so we're going to pick up on our conversation around ACT, which again is acceptance and commitment therapy. And we've spoken about two of the three pillars of ACT, which are the thoughts and the emotions. And now we're going to dig into the sensation, which I know you've spoken to intermittently as we were talking about thoughts and emotions, but really we need this third pillar to be able to integrate everything together. So take it away.
So, yeah, so talking about sensations, there's pretty much this idea that our bodies will be giving us these signs and symptoms. And a lot of us have sort of learned, at least the idea is a lot of us have learned to kind of disregard them because they can be inconvenient or overwhelming or confusing. And, like if you've ever had a time where like you feel kind of itchy, you get like kind of itchy, and then you think like, oh, other parts of me are itchy, and then you start kind of
Mm.
itching all over your body, like it can just get like a little like we can feel a little overwhelmed by our sensations. And so a lot of us, we've kind of learned to kind of like clench around certain sensations or kind of like kind of brace ourselves around sensations. And this is a lot of my somatic training is around kind of unbracing and kind of unblocking and releasing. But from an act perspective, they look at it in the same way around that, like a lot of times the sensations can feel overwhelming. So then we're going to try to control them. So similar to the emotions, like when we have emotions in us, we don't want to pay attention to it. They're overwhelming. They've maybe been linked with some scary moment in our life. So maybe if we've been really, really sad and then we've gone into a dark depression, next time that we're feeling sad and maybe crying, we are trying to like pull it together and suck it up and, don't get
Mm.
sad because people are afraid of going into a dark depression. They feel like the two are associated and that if they let themselves be sad and cry, that they're going to become depressed. And so similarly, if you're having certain sensations, a lot of times we'll kind of just try to like brace around them, not ignore them, avoid them, um, and just try to not pay attention to them in some way. But then as a result, our body, like it's still there. Like that's the thing is it doesn't go away. It's just still there, but it's just kind of persistent and it's kind of just relentless. And people can feel really haunted by these sensations. And so what we want to do is we actually want to give permission for the sensations to happen. And a lot of times I think about it as like we don't want to let our sensations happen. At least I didn't want to. When I was first getting trained in this, I was like, can I just learn how to make them go away? Like similar to the emotions.
Yeah.
But it just doesn't work like that. And also it's we can start learning that like it's our body taking care of us. It's our body trying to do the thing it needs to do. And so sometimes I'll think about it as like when if you've ever been really nauseated and like that feeling of nausea, it's just like, like you just feel awful
Yeah.
and trying to hold it together and try to
Right.
like not let yourself
All
throw
the
up.
time. Yeah.
Yeah, it's like you could feel like someone literally could spend 10 hours of their day
Yeah.
trying to hold back from
Yep.
throwing up,
Yep.
or you just let yourself throw up.
Just do
And
it.
so once you let yourself throw up, for the most part, you're going to feel better.
That's
And
right.
so what we want to do is we want to give people the tools to be able to kind of allow the sensations to occur without then feeling like they're now taking you for a ride and they're in charge, but like just creating some space for them and allowing our bodies to do what they need to do. Because typically, once we do that, we our bodies just feel a lot better. So we have to go into it though, similar with the emotions. We have to go into it not with an agenda of like, oh, I'm going to make space for my anger because then maybe my anger will go away. It's like if we go into it with that agenda, our anger is going to know and it's going to stick around. But if we go into it creating space for the anger and being like, okay, anger, looks like you're going to hang out for a little bit. You're going to come with me to the grocery store and then we're going to go hop on that call. And if you're still around, you're still around. But all right, fine. I'm going to make a nice space in my chest or my belly for the anger. So we're going to do the same thing with the sensations. So a little exercise you can even do in real time is to just sort of check in with your body, just kind of bring your attention to your body and just notice if any sensations are coming up. So we can even do this in real time if you're up for it. But if you notice
Yeah.
any sensations coming up, and it could be a little twinge of pain, it could be um, some kind of vibration, it could be heat, it could be cold, it could be um, uh, vibration that's like going up and down throughout your whole body, like anything like that. So is there anything that you're noticing in your body right now?
Yeah. Like have a little bit of a headache, a little bit of congestion up here.
Hmm. Okay. And so what do you want to do? Like when you kind of notice that, do you notice any like
I want to
urges that
ignore it.
you want to ignore it? Okay,
I want to ignore it. Like I want to act like it's not there.
totally.
Like you said, like it's annoying. Like we're having a meeting right now, you and I.
Yeah, it's like stop it. Yeah, right. Yeah, it's like a dog barking or something like that.
So what do
So
we do?
So instead, what we're going to do is we're going to go in and we're going to create. So in ACT, sometimes we'll use the language of expansion. So almost allowing
Mhm.
the sensation to get as big or expand as much as it needs to. Or in somatic language, we might just say, okay, just go ahead and let it do whatever it needs to do and just see what happens next. So if it's a headache, you almost say, okay, headache, you can get more intense. If it is tightness in your chest, you actually allow it to get tighter. If it's your heart racing, you let your heart, you say, all right, heart race as much as you want. A classic one is if you have like an eye twitch, if your like eye is like doing one of those like twitchy things, you just say, okay, eye twitch as much as you need to. So we're just going to create some space for that. Okay, so like right now, so you're
Mhm.
creating some space for the headache, just letting it get bigger, more intense, whatever it needs to do. What do you notice happens
Mhm.
next?
Well, I was doing it as you were talking, and I mean, if I say it, people aren't going to believe it but it actually it got better. It's better right now.
Yeah,
It could just be just random chance. I don't know, but it
it
feels
could
better right
be.
now.
Yeah, because a lot of times the discomfort, the idea is that the discomfort we're feeling is actually
Mm,
from the struggle with trying to control it rather than from the actual pain of the symptom. And so, again, it's like if you're having a lot of anxiety and your heart is racing, a lot of times it's that feedback loop of the thoughts of like, oh my God, my heart's racing down into the sensation, which then makes your heart race more because that's kind of how it works.
that's right.
And so by interrupting that feedback loop, by not engaging with the thoughts, but instead really bringing our attention to the sensations and allowing them to get bigger, sometimes our body will just kind of do what it needs to do and then it stops doing it because it doesn't need to anymore. It's not fighting, we're not fighting it anymore. So this is kind of a general practice that we can play around with. Like, so if you're having a lot of like pain, so for me, I had a lot of pain. I had an accident when I was a kid, as you know about, when I really injured my neck when I was about 9. So I had this chronic pain, like literally my entire body hurt all the time. It was kind of felt like it was on fire. And I would get all these like twinges and stuff in my lower back and my upper and my neck and my chest and my shoulder. It was all the time. And so pretty much what I would constantly want to do is be stretching. And like I remember being a kid and like kind of rubbing my like the sides of my shoulders or something up against like a corner of a wall just to get some relief, kind of like some pressure on there. But really what we want to play around with, and again, massage and all that, like this took also a lot of physical therapy and exercise and postural training and things like that. So this is not purely how I treat this chronic problem. But one of the things I've really learned is because again, from the time I was a kid, I constantly want to be doing these kind of like stretches to kind of make the feeling go away. But I'm telling you, it never worked. It would feel good in the moment, like if somebody was like actually pressing their fingers into it, but then it would just come right back. So one of the things that you can really do is if you're having a lot of tension or something in your neck, is just sort of let it, if it wants to get tense, is letting it get tense, letting it get super tight and kind of just leaning into it and just not just like essentially getting out of the way. That's the only thing. Just get out of the way and let it get as tight and kind of intense as it needs to. And you just give
Mhm.
it permission, like, okay, I might walk around like this for a while, but really, once you do that, and then let it do it until it's done, it kind of just like goes away. It just kind of does. Now, again, we can't have the goal of it to make the pain go away. It's more just kind of a cooperation, kind of like, all right, body, do you want me to get out of the way so you can do what you need to do? And it's just creating some space to expand the sensations rather than try to constrict and kind of like tighten around them. So that's
Mhm.
sort of like the first part of it is this idea of expansion. So noticing the sensation, making some space for it, not engaging with the thoughts, because the minute the thoughts are like, oh my God, I'm going to be in a meeting and then I get
Mhm.
to do this, we have to really work on making sure to diffuse the thoughts. We can notice any emotions that we have around it, but then really creating space for expansion for whatever the sensations need to do. So that's kind of the first step of this, playing around with sensations from an ACT and somatic model.
Yeah, that's really interesting. Sounds slightly crazy,
Yeah,
to
for
be
real.
honest.
I'm sure this does
You
to a
know,
doctor. Yeah.
no, it does. It just like I'm just trying to think as it relates to breathing problems, right? The patient is having a hard time breathing. I mean, we know that there is this vicious circle that happens, a vicious cycle that happens where the the person starts to say, oh my God, I can't breathe. And then they have shallow breathing. And then they have more what we call air trapping. Air can't get out of the lungs. And then the diaphragm gets flatter. And then it really is worse objectively. And it just, no. And that the way out is really to like pause. And as we learned last time, like just put the thoughts aside regarding I can't believe this is happening to me again. Oh my God, what's going to happen? And then the emotion of fear that you can't breathe, or maybe embarrassment, or,
Yeah.
and instead saying, I'm just talking this through as to what then you would do with the sensation would be like, okay, um, I mean, is it that you're almost not afraid of it? Like you're just kind of giving it permission because you're not afraid of it? Is that what
Yeah,
it is?
I
It's like,
really like
okay,
that
go ahead.
language. Yeah, I think that that language is important because I think a lot of us, at least I can tell you, like I was very, very afraid of the sensations because they're associated with a lot of chronic pain and a lot of misery and suffering, and it's been like a lot of feelings of isolation, feelings of hopelessness, kind of believing this might be the rest of my life. I mean, it was the kind of thing of like each pregnancy, every new baby that I had, I was dealing with these sensations. So it was very loaded. It was very connected to sort of like my life and limitations. And so the fear response and kind of the confusion to these sensations in our body can be really intense. But something I really want to name is the more that I was trained somatically to understand the sensations in the body and kind of that it's like they're like signals and like our body's trying to talk to us and our body was there too. And, like all this idea of like kind of the sensations that we're experiencing. When I talk to kids, specifically like my kids, when my kids have sensations or something, the minute I give them this language or permission to just let the sensations do what they need to do, they don't question it. They just do it. They don't even it's so intuitive for them to do that. And so I really do believe that these are learned feared responses. This is because we kind of
Mm,
carry it around with us, or like when we're little and we're complaining about something or we're upset, it's a lot of like, I don't know what to do with this, and so if you're a kid and you've ever had some kind of an accident or like your eye is doing something weird or your hands are trembling like this, a lot of times a teacher or a coach or a parent is going to be like, oh my God, like kind of like they're going to be flipping out too. So that's like that feedback loop where we're really learning to fear these sensations because other people fear them. One of the most common things I hear when people come in for like needle phobias or blood phobias is people will describe at least one incident in their past when maybe they were getting a needle or the blood drawn or something, and some health professional either panicked or scolded and
mm,
kind of shamed somebody for whatever was going on. So maybe they passed out and then, somebody panicked and like freaked out. And then it was like, oh my God, like, so if it's that feedback loop of the other person and seeing how they're responding that can really create a lot of fear for us. And so by like what we're really doing is we're kind of unlearning that feared response. We're unlearning the
yeah.
the avoidance or the distraction because it's it's just not serving us. But for adults, it's a lot harder. For kids, it's a lot more intuitive because our bodies really are made to like, inherently heal themselves in so many ways. And at least for the day-to-day stressors. And so, we're able to, if we could hold back from throwing up all day, you're gonna have a terrible day. A terrible day.
Yeah.
Whereas if we learn to throw up, we're gonna be, feeling a lot better.
Yeah, or maybe it's that, we're not saying that there's nothing to be fearful of not being able to breathe. Like that's scary, no
Yeah.
question. And it's possible that you could actually get into serious trouble by not breathing, for example, most notably in asthma cases.
Yeah.
But what we're saying is if you can try to almost de-escalate the entire thing, the chances of you making the right decision, whether it be call 911, call somebody, leave the smoky space, put something over your mouth, get your inhaler, XYZ, all of the things that we teach people to do, the chances of you being able to comply with those things are much greater if you're able to kind of go through these motions of thoughts, emotions, and sensation. And maybe even it's something like, okay, you know what? Right now, it's going to be a challenging time. Let me just kind of do the things I know, get myself away from the exposure, and allow the body to just work its way through the airway narrowing as I take my inhaler and just kind of give it space, give it time.
Yeah.
This is great. I know there are other elements to sensation that we'll pick up on the next time as we continue to integrate all the different components for ACT. So we will pick it up.